You know what? Hold that thought, because Governor Deval Patrick is now welcoming President Obama to Faneuil Hall in Boston. Let's listen in.
Hello, Boston! It's good to be back in Boston. It's good to be back in Boston because one of America's best governors introduced me, Deval Patrick. Give him a big round of applause. It's good to see Congressman Bill Keating here. Give Bill a big round of applause. I want to praise somebody who's not here. I just left him, but he wears his heart on his sleeve. He loves this city so much, and it shows in what he's been doing for years now. One of America's best mayors, Tom Menino. And it's good to see all of you. You know, I was just at the airport. Deval was kind enough to meet me along with Mayor Menino, and Mayor Menino went back to City Hall to work so that he could wrap up in time for the first pitch. I understand that. I am well aware that a presidential visit is not the biggest thing going on today in Boston. I understand that. I tried to grow a beard, but Michelle, she wasn't having it. I am also old enough to remember a time when the Red Sox were not in the World Series 3 times in 10 years. But I know the chance to win one at home for the first time since 1918 is a pretty special thing. So I promise, we will be done here in time for everybody to head over to Fenway and maybe see Big Papi blast another home. And maybe the other Sox will do better next year. I'm just, you know, you can hope, you can dream. The reason I'm here, though, is because this is the hall where, 7 years ago, Democrats and Republicans came together to make health reform a reality for the people of Massachusetts. It's where then-Governor Mitt Romney, Democratic legislators, Senator Ted Kennedy, many of the folks who are here today, joined forces to connect the progressive vision of health care for all with some ideas about markets and competition that had long been championed by conservatives. And as Deval just said, it worked. It worked. Health care. Okay. Okay. We're talking about health care today, but we will. No. That's okay. That is the wrong rally. We had the climate change rally back in the summer. This is the health care rally. Now, so health care reform in this state was a success. That doesn't mean it was perfect right away. There were early problems to solve. There were changes that had to be made. Anybody here who was involved in it can tell you that. As Deval just said, enrollment was extremely slow. Within a month, only about 100 people had signed up. 100. But then 2,000 had signed up. And then a few more thousand after that. And by the end of the year, 36,000 people had signed up. And the community all came together. You even had the Red Sox help enlist people to get them covered. And pretty soon, the number of young uninsured people had plummeted. When recession struck, the financial security of health care sheltered families from deeper hardship. And today, there is nearly universal coverage in Massachusetts, and the vast majority of its citizens are happy with their coverage. And by the way, all the parade of horribles, the worst predictions about health care reform in Massachusetts never came true. They're the same arguments that you're hearing now. Businesses didn't stop covering workers. The share of employers who offered insurance increased. People didn't get left behind. Racial disparities decreased. Care didn't become unaffordable. Costs tracked what was happening in other places that wasn't covering everybody. Now, Mitt Romney and I ran a long and spirited campaign against one another. But I've always believed that when he was governor here in Massachusetts, he did the right thing on health care. And then Deval did the right thing by picking up the torch and working to make the law work even better. And it's because you guys had a proven model that we built the Affordable Care Act on this template of proven bipartisan success. Your law was the model for the nation's law. So let's look what's happened. Today, the Affordable Care Act requires insurance companies to abide by some of the strongest consumer protections this country has ever known, a true patient's Bill of Rights. No more discriminating against kids with pre-existing conditions. No more dropping your policy when you get sick and need it most. No more lifetime limits or restrictive annual limits. Most plans now have to cover free preventive care like mammograms and birth control. Young people can stay on their parents' plans until they turn 26. All of this is in place right now. It is working right now. Now, the last element of this began on October 1st. It's when the Affordable Care Act created a new marketplace for quality private insurance plans for the 15% or so of Americans who don't have health care, and for the 5% of Americans who have to buy it on their own and they're not part of a group, which means they don't get as good a deal. And this new marketplace was built on the Massachusetts model. It allows these Americans who have been locked out to get a better deal from insurers. They're pooling their purchasing power as one big group. And insurers want their business, which means they give them a better deal. And they compete. for that business. And as a result, insurers in the marketplace, they can't use your medical history to charge you more. If you've been sick, you finally have the same chance to buy quality, affordable health care as everybody else. A lot of people will qualify for new tax credits under this law that will bring down costs even further. So that if you lose your job, or you start a new business, or you're self-employed, or you're a young person trying several jobs until you find that one that sticks, you're going to be able to be insured. Insurance that goes with you and gives you freedom to pursue whatever you want without fear that accident or illness will derail your dreams. Now, this marketplace is open now. Insurance companies are competing for that business. The deal is good, the prices are low. But let's face it, we've had a problem. The website hasn't worked the way it's supposed to over these last couple of weeks. And as a consequence, a lot of people haven't had a chance to see just how good the prices for quality health insurance through these marketplaces really are. Now, ultimately, this website, healthcare.gov, will be the easiest way to shop for and buy these new plans because you can see all these plans right next to each other and compare prices and see what kind of coverage it provides. But look, there's no denying it. Right now, the website is too slow. Too many people have gotten stuck. And I am not happy about it. And neither are a lot of Americans who need health care. And they're trying to figure out how they can sign up as quickly as possible. So there's no excuse for it. And I take full responsibility for making sure it gets fixed ASAP. We are working overtime to improve it every day. Every day. And more people are successfully buying these new plans online than they were a couple of weeks ago. And I expect more people will be able to buy conveniently online every single day as we move forward. We're going to get these problems resolved. Now, in the meantime, you can still apply for coverage over the phone or by mail or in person because those plans are waiting. And you're still able to get the kind of affordable, reliable health insurance that's been out of reach for too many people for too long. So I am old enough to remember when there was not such a thing as a website. I know that's shocking to people. But the point is, I'm confident these marketplaces will work because Massachusetts has shown that the model works, and we know what's being offered by these insurers. We know it's going to work. And so far, choice and competition in the new national marketplaces have helped keep costs lower than even we projected. In fact, nearly half of all single uninsured 18 to 34-year-olds may be able to buy insurance for $50 a month or less. Less than your cell phone bill, less than your cable bill. And one study shows that nearly 6 in 10 uninsured Americans may find coverage for $100 a month or less, even if they're older than 34. And frankly, if every governor was working as hard as Duvall or Governor O'Malley in Maryland or Governor Cuomo in New York to make this law work for their citizens, as opposed to thinking politically, about 8 in 10 Americans would be getting health insurance for less than $100 a month. And by the way, it's not just in Massachusetts. Look at Kentucky. Governor Steve Beshear, who's a Democrat, is like a man possessed with helping more people get covered. He thinks it's the right thing to do. Keep in mind, I did not win in Kentucky. But there are a lot of uninsured people in Kentucky. And they're signing up.